Well, hello, I'm Dr. Carolyn Richardson, and I would like to welcome everyone to my webinar, The 4 A's for Efficient Workflow and Productivity. I'm Dr. Carolyn Richardson. I'm your host for this webinar. I've been a pediatrician for 30 years. I have worked in several medical settings, private practice, HMOs. I've worked in government clinics, and I currently work locum tenens. I've had opportunity to work in various medical settings and with all types of support staff. And so I have developed the 4 A's for efficient workflow and productivity. The 4 A's are aware, anticipate, acknowledge, and act. So we will start the webinar. Welcome to this webinar. We are about to get it underway. So, as I said, the title of this webinar is the 4 A's for Efficient Workflow and Productivity. And during this session, we will be discussing ways to improve productivity by optimal communication and cooperation with all staff members. By the end of this discussion, you should understand the importance of the 4 A's: aware, anticipate, acknowledge, and act, and be able to implement the 4 A's to provide optimal healthcare or other business service in a timely manner. We will start the first audience poll. Just wondering if you would happen to know the average wait time in your office. So please select from the choices. So you can click on which of the choices corresponds to the approximate wait time in your office. Less than 15 minutes, 15 to 19 minutes, 20 to 25 minutes, 26 to 30 minutes, 31 minutes or longer, you're not sure, or you don't have a medical office. I will end the polling now, and I will share the results. So as you can see, the average wait time is between 15 to 19 minutes. Now, there's an institution called vitals.com. This is a company that tracks and researches the average wait time in medical offices depending on the specialty and by state. And this is the 9th annual report for this year, states that the average wait time at the doctor's office is 18 minutes, 13 seconds. According to vitals.com, patients consider an office visit to be a pleasant experience if there is a clean office, friendly reception, an attentive physician, and a reasonable wait time. And as you can see, the average wait time is about 18 minutes, 13 seconds. It has been discovered through research that when wait time exceeds 20 minutes, patients begin to have negative feelings about the office visit. You can minimize delay by waiting by preventing delay. Delay is the thing you want to avoid to minimize waiting in your office. Delay can be minimized by these things: effective time management, being aware of the reason for the office visit, anticipating what will be needed to complete the office visit, and carrying out orders as soon as possible. So you want your staff to be aware of these things and sensitive to these things. For other types of businesses that are not medical offices, the National Business Research Institute also has done research and has revealed that customer satisfaction is the state of mind that the customers have about a company when their expectations have been met or exceeded. The achievement of customer or client satisfaction leads to company loyalty and product repurchase. Now, this is also important for medical offices because we definitely want patients to be loyal to the practice, and we definitely want the patients to come back. So we also want to make sure that we're meeting or exceeding the expectations for all types of businesses, including the medical office. When your clients or customers or even patients experience problems during their encounter, they negatively rate their encounter. So you want to minimize unpleasant encounters by preventing problems. How do you prevent problems? You want problems to be minimized if there is effective time management. Being aware of the reason for the encounter. Why is the client or customer there? Anticipating what will be needed to complete the encounter. And carrying out service as soon as possible. So we want to know, how does your staff rate? We have 3 levels. For purposes of this webinar, we have outlined 3 levels. The first level is outstanding support. Outstanding support is exemplified by staff members who work well together. They require little or no prompting or reminding to perform required tasks, and they maintain efficient workflow. The next level is a staff that needs improvement. That's where the staff members work well together about 75% of the time and may require prompting or reminding to perform required tasks about 50% of the time. These two are the reasons why there may be interruptions in efficient workflow. Staff members not working together or having to be prompted and reminded to do their required tasks can interrupt efficient workflow. And the last level is disappointing support. That's where you have ineffective teamwork by members of the staff. The staff members require frequent prompting and reminding to perform their required tasks. And for these 2 reasons, there is often a lack in efficient workflow. So now that we have described the 3 levels, we will do the next poll where we'll rate the support staff. I would like to welcome people who are now joining the webinar. Please put your response for the next poll. So this poll is For this one, we're rating the office staff. Do you consider your staff outstanding, could improve performance, disappointing, or you don't have a staff? Please answer the right response. Okay, I will end the polling at this time and share the results. Okay, we have members in the audience that at this time do not have staff. So the 4 A's for efficient workflow are as follows: to be aware, to anticipate, to acknowledge, and to act. So how do these 4 A's work together? To be aware. You want your staff members to know the reason for the patient's office visit or the client encounter. They need to know what's going on in each exam room or in the work area. And you need to know that orders have been requested or that a service is needed. After you are aware, then you anticipate what to do. What will the patient or the client need? What will the provider, the boss, or the supervisor need? What should you as a staff member be doing? These are things you can go over with your staff. So after that, you want to confirm what needs to be done. That's acknowledge. You are aware of what's going on. You have anticipated or think what might happen. Now you want to verify this. That's acknowledge. So you confirm what needs to be done, confirm what needs to be gotten, and confirm what needs to be changed. For this third one, what needs to be changed is sometimes what you think may be needed or may happen is not what's needed and not what's happened. So there's going to be a change, and then you just want to adjust to that change and then move to the next step, which is to act. Act is time to move. You want to do what needs to be done and get what needs to be gotten. Do it right, do it well, timely, consistently, and courteously. So these are the 4 steps for your staff. To first be aware of what's going on, to anticipate what needs to happen, to acknowledge or confirm what they thought needed to happen will happen, and then act. So now that we have gone through the 4 A's, we will use some scenarios to see how a staff should respond. So, a mother will bring her newborn to the office for the first visit. Information needed for this visit will include, I will put the choices on. So the information needed for this newborn at the first visit: the nursery discharge summary, the insurance information and the mother's ID document, the hearing test and the hepatitis B documentation from the nursery, numbers 1 and 3, or all of the above. Please select a choice. So I will end the polling now, and I will share the results. Yes, this is correct. All 3 of these items will be needed to complete this visit. This is information that is needed to open a new file for this newborn. You will need the summary of what went on after birth, the discharge summary, the insurance information and the mother's ID card, and the results of the hearing test and hepatitis B. All of that documentation is needed. So you want all of the staff to be aware. This is a newborn visit, to be aware of that's what's needed. Very good. So we will go to our next scenario. You want to apply, the next scenario is a customer asks you the location of the greeting card section in the store. To provide the best customer service, you should, and I'll put the responses so that you can mark your response. Should the person ask the coworker to assist the customer? Smile and tell the customer to go to customer service, which is in another area of the store, to find out where the greeting cards are? Or should a sales associate right there tell the customer the correct location of the greeting cards? So please mark what would be the best customer service. Okay, so we will end the polling now, and we will share the results. You have to ask a coworker to assist the customer. Let's review these answers. So the best customer service, to ask a coworker to assist the customer, that means that the initial sales associate was not aware and was not aware of the layout of the store, did not know where the departments in the store were, and was not able to assist the customer. And if there's no coworker nearby and the sales associate had to kind of walk around to find somebody else to ask them, that's not good customer service. The best customer service is number 3, that the sales associate is familiar with the layout of the store, knows where all the major departments are in the store, and is immediately able to direct the customer to the greeting card area in the store. So the correct answer would be 3. Our next example, a male adult patient presents with a complaint of a bad rash on the left ankle area. To complete this visit, the physician or the medical provider might need. Now this is going to not just awareness, but also anticipation. So I will put the choices on. So to have a good office visit and have the patient ready for examination, the rash area on the leg should be uncovered. The provider might need a pair of gloves, might need an unopened sterile swab set to collect specimens, 1 and 2, or all of the above. Which one? I will end the polling now. I will share the results. Very good. So let's go over the questions. The responses are to have the rash area on the leg uncovered. So you see, in preparing the patient for examination, you want to already have everything ready to go when the provider enters the room. So if the person has on long pants or socks or boots, you want to expose the area of the leg where there's a problem. The provider may need to touch or examine the rash, so you want to have a pair of gloves available. If gloves are normally stored in the drawer in the room, you want to peep in the drawer to make sure that the glove box is not empty. You want to also make sure there's a sterile swab set in case some kind of lab specimen needs to be collected. So the correct answer you selected was right. Number 5, all of the above would be needed to have a successful office visit. The next example, a client must bring a notarized document at the time of the appointment with you. Ways to ensure that the document is indeed notarized would be, and I will put the choices on. So you want to inform the client that the document must be notarized at the time the appointment, when the person schedules the appointment, that's the time to notify them that they need to bring the document already notarized. They need to assume, you want to assume that the client knows to have the document notarized, And at the time you call to confirm the appointment, remind the client that the document must be notarized. So to be sure that the client understands to bring the document already notarized, which one of these choices is best? Okay, I will end the polling now, and we will very good. And we will discuss the answers. So I'm sharing the report results. You have 1 and 3. Very good. So let's go over the responses. Again, this is dealing with awareness, and anticipating what will be needed so that this appointment will be successful. You want to inform the client at the time they schedule the appointment that they must bring the document already notarized. And this is especially important if you don't have a notary at your place of business. And then when you call to confirm the appointment, you want to remind the client that the document must be notarized. Number 2 is not a good choice. You do not want to assume that the client knows to have the document notarized. You must inform the client to make sure that they are clear on that. The last thing you want the client to do is show up for the appointment and not be prepared because the document has not been notarized. So the correct response is number 4, both 1 and 3. We will go to the next example. A lady comes to the check-in window and tells you that she has chest pain and appears to be having difficulty breathing. You should. Now, this is awareness and anticipation of what may happen and what you should do. Let's look at the responses. Okay, should you calmly tell the lady to relax and send the provider a message and mark it urgent? Should you ask a co-worker to go find a provider immediately? Should you be prepared to call 911, have oxygen on hand, and remain with the lady? Which is the best answer? I will end the polling now and share the results. Very good. So you see, you want your staff to understand what to do in emergency situations. And the correct action is number 2 and 3. To ask a co-worker to find a provider immediately so that they can assess the patient and determine what needs to be done, and be prepared to call 911, have some oxygen on hand, and remain with the lady in case she takes a turn for the worse before the provider can get there. The wrong answer is to calmly tell the lady to relax and then send the provider a message marked urgent. If the provider is not near the EMR, is not near the computer, may not see the message. This is not the appropriate response to this situation, and reviewing things like this with your staff will help them be prepared in the event of a situation like an emergency. So the next one says, allergic reactions to food can result in a serious incident. People who have food allergies should be a concern for which type of businesses? I will put the choices on. Again, we're talking about awareness of what's going on in the workplace. So, should the people responsible be medical offices and hospitals, establishments where food is served, flight attendants who are serving snacks, schools, camps? All right, we will end the polling now, and I will share the results. So, as you can see, the correct answer is 5, all of the above. because it's not just medical offices and hospitals that have to be mindful of food allergies. Establishments where food is served definitely should be concerned about that. Flight attendants who are serving snacks need to be aware of food allergies. And of course, at schools, camps, and daycare centers where meals are served and prepared, they need to be aware of food allergies. So the correct answer is all of the above. Let's go to the next example. A high school student injured his arm during a football game today. He presents complaining that his left wrist hurts at a level of 8/10. Orders that might be requested by the provider would include. This is another example of being aware and then anticipate what needs to be done during this office visit. So the choices are: the person may need imaging of the left wrist, may need imaging of the left femur, may need a forearm sling and a forearm splint, pain reliever medication, 1, 3, and 4, or all of the above. Okay, we will end the polling now, and we will share the results. Okay, now let's go over the answer. So the correct answer is number 5, 1, 3, and 4, because the person has injured the left wrist. So of course you would expect that there's probably going to be imaging of the left wrist looking for a fracture. Since the left wrist could be a little uncomfortable in pain, if you have a sling and forearm splint available to kind of stabilize the injured area, that would be helpful. And if you have pain medication like ibuprofen, that would also be helpful. A person has no injury to the leg, so imaging of the femur is not needed. The next example, your office has recently moved to a new location. When communicating with clients who will visit your office, you should, to make sure they know where you are. Let's put the answers on. Here are the responses. Again, this is awareness and anticipating that the people will not know that you have moved. What is the correct response? For the next 4 weeks, tell the clients about the new location when they schedule an appointment or when you call to confirm an appointment. Always make sure they know and notify them through various mediums. I will end the polling now, and I will share the results. Very good. So as you can see, 2 and 3 are the correct answers. You want to always make sure the clients know about the new location, and you want to notify established clients about your new location. Your established clients especially need to know that you have moved. And you can do this through several mediums: email, website message, a little card in the mail, postal service mail. But you definitely want your established clients to know about your new location. And just doing it for 4 weeks will not be enough, because if you have people who only visit the business every 6 months or every 9 months, if you stop notifying people after 4 weeks, some of the less frequent people to your place of business will not be aware of the change. So that's why answers 2 and 3 are the correct responses. The next example, a healthy, happy 4-month-old presents for a well child visit. The parents accept immunizations for this baby. The probability that the provider will order immunizations is, and I will put these choices. So the choices are that you would be unsure, so you just wait to see what the order will be. It's unlikely, so don't plan to administer immunizations, or most likely, so prepare to administer immunizations. Which is the right answer? Okay, we will end the polling now, and I will share the results. Very good. So we will go over the answer. So since the baby was healthy and the parents accepted immunizations, there was no sickness, there's no fever, the parents weren't objected to immunizations, it's most likely that the immunizations will be administered at the conclusion of the visit. So you want to go ahead and prepare to administer the immunizations. If you wait around for the order, then that wastes time, because once the provider comes out of the room, now you have to run, gather the immunizations, start your documentation process and everything, and that creates delay and waste time during the office visit. And the choice that it's unlikely, that's not a good choice, because it's already been established that the baby was healthy, didn't have a fever, and the parents accepted immunizations. So yes, number 3 is the correct response. Our next example, a customer's order has arrived and is scheduled for pickup in 4 hours. You notice an error with the order. The error will require 2 days to correct. The best customer service in this situation would be, let's look at some results. So here are the choices. You would put a note to inform the customer that there has been when the customer comes to pick up the order, that's the time to notify them. Or you would immediately contact the customer and explain the error, apologize, and make arrangements for correction of the error. Or offer a discount and convince the customer to accept the error. I will end the polling. I will share the results. Okay, so the correct answer is number 2. You want to immediately contact the customer and explain the error, apologize, and make arrangements for correction of the error. You don't want to just put a note on the order and wait for the customer to arrive and at that time inform them of the error, because you already know that it's going to take 2 days to correct the error. So that means that's going to cause the customer to make a return visit to your place of business, and that's unnecessary. So the customer would definitely be upset and not appreciate the fact that they wasted a trip to your place of business. So the correct answer is to contact the customer immediately and explain and all that. Number 3 is not a good option, because you don't want to offer a discount and try to convince the customer to accept an error. So the best option is number 2. Now, the next example says the last patient for the day went to the first floor to have imaging performed. While waiting for the patient to return, what should you be doing? Again, we're talking about efficient use of time. So, should you calmly wait for the patient to return? Restock supplies in the rooms? Check messages on your cell phone? Clean and disinfect the rooms? 2 and 4, 1 and 3. Okay. We will end the polling now and share the results. We will now discuss the answer. So as you can see, the correct answer is yes, 2 and 4. To make efficient use of the time, and you're at the end of the day, this is the last patient, so you're trying to wind everything up and get ready to leave. So while you're waiting for the patient to return, the best use of time would be to restock supplies in the exam rooms, and clean and disinfect all the other rooms except the room the patient will be returning. You definitely don't want to just sit around and wait for the patient to return or pull out your cell phone and start. You don't want your staff members pulling out cell phones and checking their own personal messages. So the correct answer is 2 and 4. The next example, you have noticed that the provider requests a breathing treatment for children who present wheezing and exhibiting breathing difficulty. A known asthmatic presents wheezing and gasping for air. The physician or the provider might order. Let's go to these choices. So the choices are a breathing treatment, oxygen therapy, repeat measurements of the pulse oximetry, emergency transportation to a higher level of care. Very good. We will end the polling and we will share the results. So very good. You want your staff to be aware, this is another emergency situation that you want your staff to be aware of what to do. They've already seen in the past that when patients present in this condition, they get breathing treatment. Also, you usually want to check the oxygen level, and if it's low, they may need oxygen therapy. And if they have oxygen therapy, then should be expecting a order to repeat the measurement of the pulse oximetry. And then if the patient doesn't improve, they would need emergency transportation for a high level of care. So you want your staff to be aware of that all of these options could occur in this type of office visit so that they will know what to do and act accordingly. The next example. A 16-year-old male presents in October to have a physical exam performed as a prerequisite to participate in sports. The physician or medical provider may order. Again, this is being aware of the reason for the visit and anticipating what will need to be done. So the choices are MB and MCV immunization, influenza immunization, HPV booster, health history questions on the form already completed, and referral for a consultation with a cardiologist. Which of these could happen? Very good. We'll end the polling now and share the results. Let's discuss it. So you see, you want to be aware of all things. This patient is here. The reason for the visit is a sports physical, and nothing holds up a sports physical office visit except when the patient comes in and they have not answered those like 50 questions that they have to answer on the health section. So when they come in with those forms, you want your staff to immediately look at the form and make sure that it has already been completed. And if it hasn't been completed, they should instruct the patient and the parent to go ahead and complete the form before the provider gets there. Now, it's in October. That's flu season. So this patient would need you would be expecting an influenza immunization order. Also, the child was 16. So there's the meningitis B immunization that's needed. And at 16, they get a booster dose of MCV4. So that should also be checked to make sure and see if that's up to date and get that done. Also, a 16-year-old, you need to check on the HPV immunization status. So you want your staff to do that. And of course, there could be a problem with the heart where some of the answers on the health history question. And so they should be expecting there's a possibility for a referral for consultation with the cardiologist. So all of these are correct choices that could happen during this office visit. Okay, the next example. A mother presents with her 3-year-old You notice that the reason for the visit lists complaint of burning when urinating. After check-in, the mother asks the location of the restroom. You should. This is important, but because it's not just the back office staff that needs to pay attention to the reason for the visit, but it's also the front office. So let's go over these choices. So you should tell the mother the location of the restroom. Okay, very good. We'll end the polling now and share the results. And now we will go over the answers. So yes, there's nothing that will hold up an office visit when a child comes in with burning or urination, and then the child has to go to the restroom and somebody says, oh, it's over there, and nobody bothers to collect the urine. So the last thing you want to do is just tell the mother where the restroom is. You have to find out if the child needs to use the restroom, get a urine specimen cup if the child is the one going to the restroom, and let the mother know that a urine sample might be needed. So being aware of this will save time, because so many times the child will be sent to the restroom and then the provider comes in the room, reads the reason for the visit and says, oh, we need a urine sample. And the mother says, well, they just went. Now the child has to drink water and hang around, waste time. So it's very important that staff is aware of that, and you want the front office also to be aware of that. And our last example is this one. A patient has been scheduled to return to have blood drawn to test fasting lab values. Staff members who can make sure that the patient has fasted for 12 to 14 hours before the blood is drawn are. Now this is a team approach. Who all on the team needs to be aware of how to manage this patient? So will it be the MA who discharges the patient and explains about fasting for 12 to 14 hours before having the blood drawn? The receptionist who calls the day before to remind the patient about the lab appointment? And the phlebotomist who's getting the blood sample? We will end the polling now, and we will share the results. Yes, the correct answer, all of these people are responsible for making sure that the patient comes back fasting for 12 to 14 hours before the blood is drawn. So you do it at the time you discharge the patient from the initial visit, and then when the receptionist calls to remind the patient about the appointment, you want to remind them again. And then right before the blood is drawn, the phlebotomist should confirm again that the person has indeed fasted for 12 to 14 hours. That way you don't have to stick the patient unnecessarily and draw blood and get samples and get values back and then say, well, they ate breakfast, so we don't know what's going on. So all three of these people are responsible for making sure that this fasting sample is collected. So that's why the right answer is the one you chose for. Thank you. So in summary, the best way to maintain efficient workflow and productivity is to execute the 4 A's, which are to be aware, to anticipate, to acknowledge, and then to act. To be aware, you want to know the reason for the office visit or the encounter to the business. You want to know what's going on in your work area, and you want to know when orders are requested or what service is needed. After that, you want to anticipate. So you want to know what the medical provider might need for the patient or what the associate might need for the client or customer. You want to know what might happen during the encounter and consider what orders might be requested or what service might be needed. After that, you want to acknowledge. So you want to know what you thought would be needed is indeed needed. What you thought would be available, had to be available, is indeed available. And any unanticipated orders, service, or actions. So this phase is very important in the acknowledgement stage, because if what you thought was going to go on or what you thought was needed is not what's needed, then you need to pay attention for the unanticipated orders, service, or action. After that, you want to act. You want to carry out orders or service in a timely manner. You want to assist the medical provider or associate promptly. You want to attend to the patients, clients, or customers promptly and courteously. And you want to coordinate with coworkers to deliver timely, courteous service. So in summary, those in leadership roles and their support staff should communicate and cooperate with each other to make sure that all involved are aware of what needs to be done to ensure that the patient, client, or customer has the best encounter possible. This awareness helps all involved to anticipate what might be needed to ensure that the patient, client, or customer has the best encounter possible. You want to acknowledge or verify that what you thought might happen or be needed was indeed what happens or is needed. And once you have acknowledged what needs to be done or will happen, then you need to act efficiently, promptly, and courteously. Now, I would just like to say that it's good to have periodic scheduled staff meetings because they're helpful. You can review the expectations for work performance, you can address any issues or concerns, and you can correct any errors or deficiencies. It's good to create scenarios to illustrate specific events similar to the examples in today's presentation. That way, people will know ahead of time how to act in various situations. There's a Chinese proverb that says, "If you tell me, I'll forget. If you show me, I might remember. But if you involve me, I'll understand." By creating scenarios and the multiple choice answers and reviewing what's the right course of action, you're involving and engaging your staff to know what to do in various situations. So by executing the 4 A's, wait times, delay, and problems will be minimized. Your staff will be the support staff the patients, clients, or customers deserve, working at a business that patients, clients, or customers deserve. Now, if you saw anything during this webinar and you feel that this would be helpful for your staff, I have a company, Customized Office Solutions, where I can provide online training and in-service via a Zoom telemeeting, or I can do on-site consultations where I can do assessment and follow-up. And if you have not already seen the webinar, Staff Assessment and Selection, the Able, Ready, and Willing Methodology, you can do so on demand at Doxy Rich 3 TV on YouTube. You can contact me. This is my phone number, 713-825-6898, if you need more information or would like to discuss any type of in-service or consultation. So I would just like to thank everyone for participating in this webinar. And if you have any questions, you can pull the down to the Q&A section at the bottom and click on that icon, type in any question that you may have, and then I can respond. I'd like to thank you for your participation in this webinar, the 4 A's for efficient workflow and productivity. So it would seem that we don't have any questions. So I would like to thank you for your participation in this webinar. Have a good evening and thank you.